Hi, so congratulations, you're being discharged. Here's some paperwork for you to go over, which includes things about your condition, when to call the doctor, things to be looking for. So just go over it, and if you have any questions, just let me know. So in nursing school, I was always told that patient safety and patient education were two of the most important things. But once I was in clinicals, patient education was something that I saw the least of. And as a new nursing student, if we had any downtime and we weren't sure what to do with ourselves, we would all kind of huddle together and hide in a corner somewhere. And then one day an instructor said to me, whenever you have downtime, that's the perfect time for you to be educating your patients. I started to really focus on patient education once I noticed how many of my patients really didn't understand their condition, especially my patients with diabetes, and they were being discharged and going home still not really understanding their condition. As healthcare providers, patient education is a really important part of our job that I feel gets overlooked. So today I'll be discussing patient education. I'll be going over what it is exactly, why it's important, and things we can do to improve. So what is patient education? According to the American Family Physician article that I read, patient education can be defined as the process of influencing patient behavior and producing the changes in knowledge, attitudes, and skills necessary to maintain or improve health. So, why is it important? According to the article by Pediatric Child Health, good patient education results in improved outcomes through better compliance, healthcare utilization, and satisfaction. The authors from Patient Education and Counseling discuss how early detection of physiological deterioration has been recognized as essential to prevent adverse events, including unexpected admissions to the ICU. So, in school, most of the time what I saw was nurses coming in, just as I just showed you, with a brochure or some kind of paperwork and just giving it to the patient saying, hey, read this over, and if you have any questions, just let me know. But really, that way of patient education isn't effective. What are they really learning? Are they even looking at the brochure? So we have to look at our patients individually and how they learn. What's the best way to approach this education? A study was done from the authors of Pediatric Child Health. It involved evidence-based ideas, and the three authors presented three different theories about human cognition and how it relates to learning. One of the theories was the dual code theory, which suggested that humans have different channels for different kinds of learning, like one channel for audio visual learning and one for reading. So when presenting information using both of these channels, the outcome of knowledge uptake was greater than presenting one or the other. So also we need to be looking at what we're presenting to them. The authors from an AJR article that I read looked at 138 patient education articles from the website radiologyinfo.org, and what they found was that the articles were written at between a 10th and 14th grade level, which the American Medical Association and the National Institute of Health recommends that all patient education material be written at a 7th grade level or lower. So these were written at a much higher grade level, which I'm assuming is most of the case when it comes to online articles. So we need to be careful about what it is that we're presenting to our patients. And something very simple that we can do to change this is, instead of just going into the room and handing them a brochure, if we come in with the brochure and we actually sit down with our patient and open the brochure with them and say, okay, so this is the important stuff and what you should be looking for. Other things we could do is pull up pictures online of something like a rash or edema or anything really that they should be looking for, so that way they have a visual and know when to call the doctor. You could also see if they have a smartphone and they could download apps, say about diabetes. So today we talked about patient education. Now we know what it is. It's influencing patients' behavior to produce knowledge. So we need to find out how exactly we can do that the best way possible. We know that it's important because it reduces the patient being rehospitalized and coming back for the same issues. And now we know better ways to do it. It's really just taking that time to know your patients, know how they would learn best, and presenting them with the information and really making sure they understand it by having them read back to us. So doing this, we could really all make a big difference in our patients' lives.